Hi, thank you so much for coming onto the podcast. Just before we get into all of our questions, our topic for the day, would you like to introduce yourself?
Yeah, thank you for having me on. It's very exciting. Hi, I'm Bea. I am a mum of two. I live in sort of Leicestershire, Nottinghamshire area, literally smack bang in between Leicester and Nottingham in the middle of absolutely nowhere. I'm a hypnobirthing teacher and antenatal instructor, also a breastfeeding counsellor. And before that, I was a breastfeeding peer supporter, so kind of like gone up the levels a little bit. But I also am an infant feeding support worker within the NHS as well. So like my whole life is basically vaginas and boobs, pretty much. That is 24/7 all I do.
So people are like, what do you do? Why do you have like big boobs all around your house
Yeah,
and pelvises and stuff like that? And like, it's just easier to not
it's
even go
just my
into
life.
it. Just take it over at this point.
Yeah.
So you are a relatively new hypnobirthing teacher, but like you say, not infant feeding support. So how did you get into that?
Infant feeding support. I always knew I wanted to breastfeed. So my oldest is 6 now. And when I was pregnant, I always knew I wanted to feed, but I didn't do any preparation. I didn't really know anything about it. And then when it came round to her being born, I was like, whoa, what's going on? This is very overwhelming. I didn't know what to expect. And I started just like researching myself and finding out all about it. Like the first thing I realized, like, and started researching was like cluster feeding. And I was like, oh, this is really interesting. And then I started passing it on to other people that were like in Facebook groups going, oh, my baby's doing this. What about this? And I started just researching and like answering questions for other people. And I was like, I love doing this. I love passing on this knowledge that I've learned to other people. And then when she was about 6 months old, my local breastfeeding support group were offering training to become a peer supporter. And I was like, yes, I definitely want to do that. And completely jumped on it and was just totally fascinated by everything that I learned in the course. And I started volunteering weekly at the local breastfeeding group, and I still volunteer weekly now. I absolutely love it. But then I was like, I just want to learn more. I want to keep doing more with this because peer support is brilliant, but it's knowing like all the basics. And I was like, I want to learn more. So I did the breastfeeding counsellor training. And yeah, that was absolutely fascinating as well. And I just loved it so much. And I was like, I want to do this as every day as my job. I want it to be my career. And infant feeding support work doesn't come across very often in paid roles. And so when one did, I was like, yeah, jumping at it. Absolutely love it. And it is fantastic. I absolutely love it. It is so rewarding. And yeah, I just love passing on the information, to be honest. It is something that I feel really, really strongly about that everyone should have that, the knowledge. And it makes me feel very good. It's very rewarding hearing other people being like, you sort of see the light bulb moments and go, oh, that was so helpful. Thank you. Like, yay. It's brilliant.
Yeah. 100%, and I bet you're starting to see that as well with the birth work that you're doing now, and it's a very similar story for most of us birth workers, isn't it? That it's the same sort of thing, that we have our birth experience and we maybe don't do enough preparation, or we do a little bit and
Yeah.
then we delve deeper and we're like, why doesn't everyone know this? Like, why isn't it out there? And it's just the exact same thing with feeding. Like, I was the same. I wanted to breastfeed, but I did no preparation because I didn't really know what preparation was out there. I was
Right.
like,
What is
surely
there
just
to prepare?
have a
You just plonk a
baby.
baby on your boob. That's all that
Yeah.
it is. I didn't think was anything more to it.
Yeah, it's like that's it, and it's not. It's something that we've completely lost from our culture. Is preparing for birth and preparing for breastfeed. Because if you think of years gone by, it would have just been the knowledge that was passed down to us from
Yeah.
family and friends and aunties and siblings. But we don't do that anymore. We just
Yeah.
go, yeah, I'm gonna have a positive birth and leave it to chance. I'm
That's
just
it.
gonna breastfeed and
Yeah.
leave it to chance. And it's like we've lost that knowledge, so we do
Yeah.
need people that are passionate about it to pass it on. So I think yeah, it's really important.
We're not around people that feed very often now. We are a very formula feeding society.
Yeah.
So it means that lots of people actually haven't seen anyone breastfeed probably until they have their own babies. So it is really difficult to just kind of go into it and just do it without seeing anything at all. So it is really hard.
Yeah, I'd never seen anyone breastfeed. My mum breastfed me, but I obviously didn't see that, I don't remember it. And then as I got older, no one in my family breastfed except for one of my aunties, but I didn't live close to her, so I never even knew that she breastfed. I never saw her. Nobody else that I'd been around was breastfeeding. I didn't have any friends who even had babies. I just had this weird thing in my head where I was like, I'm definitely going to breastfeed, but I knew nothing about it. Never, even on the street, like you barely. I made a point of breastfeeding everywhere, like,
Yeah.
but like a lot of people
Just to
don't.
do it. Yeah.
Yeah,
Just to
and yeah,
make it sort of more normalized, just be
yeah,
able to do it whenever you can. And yeah, I was really lucky that my mum breastfed me and my three sisters. So she was really sort of knowledgeable. So I was literally like messaging her after I had my first, like, what's going on? Is this normal? She's like feeding for 5 minutes and then off for 5 minutes and then on again. What's going on? And she was amazing, like reassuring me. But again, because we're in that formula feeding society, a lot of people won't have like parents or family members that did breastfeed. So they might not get the same sort of response. They might say that and then go, oh, maybe you're not making enough milk. You probably need to bottle feed instead. So it kind of, that generation as well don't really understand breastfeeding a lot of the time. So I was really, really lucky that I had my mum that did understand it.
yeah, definitely. And I think also, as you say, like, because so many people formula feed, I think there's also like it's accessible to get information now with the internet and stuff, and that is great. But also, then you get so many different opinions online. So if you post something, like for example, like you said, in a group, in Facebook groups, on forums, things like that, why is my baby coming on and off every 5 minutes? You're going to get those people who are not trained, but who have just had it happen to themselves, and they go, oh, I had that, and it's because I had low milk supply, and you probably do too. So you need to top up, and it's
Absolutely.
like. No, not necessarily.
Yeah,
It's really
absolutely.
hard, and you don't know who to believe, and you're hearing so many different opinions from different people, and it's really tricky because it's not like you say, yeah, it's not generational knowledge anymore. It's
Yeah.
searching it out from a wide range of sources, for better or for worse. I do think there's a lot of pros to it, obviously, to be able to have that accessible information, but it can definitely be unhelpful as well.
There can be a lot of conflict,
Yeah,
especially online. You can get people will say, well, I read one thing on one site and then a completely opposite thing on one site. And it's trying to figure out, well, actually, what are reputable sources as
yeah,
well? It can be really difficult. Like there's so much breastfeeding information actually on formula company sites, and they come up really high up when you like type something in on Google and you just click on it, and then it'll say something that maybe isn't actually 100% true. Like, oh, if your baby is not sleeping through at 6 months old, maybe they're not getting enough milk by breastfeeding. Maybe you need to supplement with formula. That is something that
yeah,
commonly does come up. So it's actually figuring out what are the reputable sources, what ones that you can trust and
yeah.
know that it is accurate, because that's really hard.
Yeah, 100%. So that kind of is a nice segue into what we're going to talk about, because we've not even mentioned it yet. But what we're going to talk about is the very first sort of few days, the early days, the first few weeks of breastfeeding, because I think that is where a lot of people get thrown. Because like me and you, we knew we wanted to breastfeed, we hadn't done any preparation, and actually those first few days and those first few weeks are really crucial to the breastfeeding journey. If you can get those first few days off to a really good start, then it is a lot easier moving forward. Whereas if you go into it and those first few days and those first few weeks are incredibly difficult, that's when a lot of people end up giving up, isn't it? Like we've seen from the stats, a lot of people end up giving up really soon after they start because they haven't got the right support. So that's what we're going to talk about today.
Yeah.
And so the first sort of thing that I wanted to talk about is just what to expect in those first few days, because so many people just do not understand normal infant behavior, do we? It's not something as a society that we talk about. We
No.
talk about sleep like a baby, and as if that's a good thing. Everyone should sleep like a baby. I'm like, have you ever met a baby?
They do not sleep. That is not the right term to use. God, no. And yeah, you're totally right in terms of we've just lost as a society what normal newborn behavior is. And I really think that is one thing that if you are pregnant, to search about now before it comes around to it, because every baby is going to behave like this, regardless of your feeding method, whether you're bottle feeding or breastfeeding, they are going to behave like this. And you need to know about it first so that when it comes to it, you're not in complete shock and thinking, well, my baby must be completely broken, because they're not. They have a survival instinct in
Yeah,
them to literally need to be close to you. It is a need, it's not a want. They're not manipulating you. They literally want to be with you 24 hours a day, 7 days a week, constantly. But yeah, in the first week, that is probably, it's a very full-on time. I always say if you can get through that first 7 days, you've set yourself up really, really good, because that is the toughest point. There's so many changes that happen in that first week. And really set expectations really, really low for what's going to happen. You probably are going to be mostly feeding. You're
Yeah.
not going to be up and about, going to the shops 2 days after giving birth. You probably are going to be sat on the sofa or in bed feeding quite a lot. But in those first 24 hours, it can almost set you into a false sense of security, because your baby is very tired after birth, regardless of how you've given birth, even with a cesarean. They're going to be tired, and they tend to sleep very well. They only feed maybe about 4 or 5 times in the first 24 hours. That's completely normal. And they settle into their cot or their Moses basket beautifully. And you go, oh my goodness, I've got such a good baby.
Yep.
This is so easy. Wow. And then suddenly the second day comes around and they're okay, maybe a little bit more awake. But then the night comes and they wake. They will not be put down. They are feeding really, really frequently. They're fussing at the breast as well to increase your milk supply, basically. But they just wake up and they are very much not wanting to go down in their cot. And you can't do much else apart from that. And they call this second night syndrome. And it really is something to prepare for, because the first time, oh my goodness, it came as a massive shock to me. I
It's
had
so
no
hard.
idea.
It's so hard because as well at the same time, your hormone levels are
Yeah.
dropping as well. So your everything feels like a disaster. Like you're so happy to have a baby, but your hormones and your emotions are insane. They're absolutely raging. And everything is like, I mean, it's ridiculously hard anyway, that night, that second night. I remember it so well. But then on top of it, everything's like at catastrophe level 100 because of what
Yeah.
our hormones are also doing at the same
Oh
time.
God.
It's like a
I was
perfect storm.
crying so much on that second night.
Me
I was
too.
just bawling my eyes out. I was like, what's wrong with my baby? She's broken. There's
Me
something
too.
wrong. And it was
Yeah.
just, I wish I'd have known about it before, because it is really normal. And if you know to expect it, it's then a good idea to maybe prepare for it. So get some sleep in during the day leading up to that second night. And a lot of the time, that tends to be a day, the second day where you've probably, if you've given birth in the hospital, you're home and people like to come visit. You have your parents around, some family, and they all like to come meet the baby, and you're hosting and you're absolutely shattered anyway. And then you're like, right, okay, bedtime, let's try and get some sleep. And then this baby just doesn't settle. And then you're even more shattered. So, a big tip for that for me personally is, if you can, just say no to visitors on that day leading up to that second night, so that you can just get some sleep in to prepare for it, because it is a lot easier to handle if, one, you're prepared for it, and two, you've had a bit of sleep leading up to it, rather than being completely sleep deprived leading up to that. So yeah, second night syndrome is a big one to be ready for, because it is a bit of a shock. And a lot of people at that point then worry that I've not got the milk because they're not settling. They'll only sleep in my arms. They're feeding loads. And that's commonly where people do start to maybe top up or start giving, extra in a bottle or something, because they are so worried that actually they've not got the milk. And that is a common concern when people sort of use the behaviour of the baby as that worry that they haven't got the milk supply, and that tends to be very common as to when it starts. But yeah, then after day 2 or night 2, around day 3, 4, you start to get the transition of your milk supply. And I call it transition rather than milk coming in, because a lot of people, if you say milk coming in, they go, oh my God, well, what happens before then? I've not got
Yeah.
milk. And you absolutely have milk. You've got colostrum that is started to be produced from about 16 weeks of pregnancy. So you have got colostrum. So I tend to say milk transition to mature milk rather than milk coming in, so that it makes it very clear that there is milk before then.
Yeah.
And at this point, it is very common for babies to cluster feed, to get that milk in a little bit more, to bring it in a bit quicker. You tend to get, when the milk does suddenly change, very, very full and engorged breasts. They suddenly fill up and you just like, where did they come from?
Yeah.
What's going on? And they can feel very warm and very, very heavy. And they can be a bit sore and painful sometimes when they're engorged. And it can mean that then baby does struggle to latch on a little bit because they're so full. So it's trying to keep them as soft as possible. So actually the baby cluster feeding and feeding frequently is actually helping your breasts to be a little bit softer. So it's helping the baby to come onto the breast nice and easily. We want soft breasts, actually. We don't want full breasts. Full
Yeah,
breasts
I,
aren't
I
good.
definitely found that with Izzy, with my eldest. She was like a good sleeper. I'm saying that with quotation marks. She's still a normal sleeper, but like I've had a baby that doesn't sleep ever. So
Yeah.
Izzy was like a good sleeper, and she would sleep for like 3 hours from being born. But I hated it when my milk came in, because by that second
Yeah.
hour, I was like, please
Wake
feed, please
up.
relieve me. I was like, please wake up. And I was like, you never wake a sleeping baby. I'm not going to do it. And I'd just be laid there in pain, like, please
Oh no.
wake up.
Oh no. That's not nice. It is. It's an agonizing feeling sometimes.
So
But
intense.
it does, go down after a
Yeah,
couple of,
it didn't last for
not
long.
that
It
full
was
on, full on.
literally just like a couple of days.
Yeah.
It was like that was all it was. It was a couple of days, but it was just like I've gone from like this hell where you won't stop feeding on night 2 to then
Mm.
my milk came in on day
Yeah.
3. So it was literally like the next day to like,
Yeah.
oh, and now it's the opposite.
Yeah. It's because she worked so hard at bringing in that milk
Yeah.
and doing that transition. And then they were like, right, I've done what I needed to do. It's time for me to sleep now.
And I was like, right,
I've
okay, I'm
done what I
waking.
needed to do. I did the work and it's now in. The milk
Yeah.
is fully through. I'm all good.
Yeah.
What a lot of people do notice as well on that sort of day 3, 4, when the milk does transition, is a huge change in your hormone levels. And it's very common to just cry on that day. So many people are just like, I'm just crying all the time. I don't know what's wrong with
All
me.
the
And
time.
that's absolutely fine. It's really normal. It's because of that sudden hormone shift.
Yeah.
Yeah, just lots of cuddles. Get loads of cuddles at that point and talk to people. Don't
Yeah.
just sit there and just think that you're unusual and stuff. It's totally normal. Everyone's going through it.
Yeah, 100%. I think that's something that's really would be super helpful to normalize for people, because there's that pressure in there, like, why are I happy? I've wanted this baby for so long. Why are I happy? And it's like, it's not that you're not happy. It's hormonal. It's like your biology. It's nothing that you can change about it. Because I just cried, especially the first time, just cried for nothing. And like I remember my partner just being like, why are you crying? I don't know.
Yeah,
No idea. Just
I
crying.
don't know why. I'm just crying.
Yeah, all the time.
Yeah. And around this time as well, you might notice a change in the nappies. So the colour of the poos will change a little bit because of that transition of the milk. It'll go from being sort of like dark to yellow. And that's a really good sign as well that you are, giving your baby lots of milk because of that change in the colours. That's what you want to look out for. And that can be really reassuring to people that, oh, yeah, they're getting plenty of milk because of that change in the colour of the nappies. I'm doing well. And knowing the signs of sort of your baby getting enough milk, I think is again really, really important so that people can be reassured, because you do very commonly in this first week, people are so worried about how much milk their baby is getting and if they are getting enough milk because of these behaviors, because they are cluster feeding, because they won't be put down in their cot. They do automatically go, well, I must not be making enough milk. I speak to people constantly. This is probably one of the most common concerns actually with people in my job, is that they go, yeah, I'm breastfeeding, but I don't think they're getting enough milk. So I'm topping them up with formula afterwards. And I kind of delve in a bit deeper and find out that the reason why they think their baby isn't getting enough milk is literally because they say, well, they're not going 3, 4 hours between feeds and they're not being put down after a feed. As soon as I put them down, they start squirming and waking up and want to come back on the breast. So that's when I give them a bottle. And I'm just like, that's totally normal.
Yeah.
It's nothing to do with your milk at all. It is just normal. That's normal behavior. And yeah, just reassuring yourself with, well, they are getting the nappies, so they must be getting enough, is just really, really helpful for yourself to be able to reassure yourself, basically.
Yeah, that's such a good point actually, because it can be really hard. And I mean, like I said, like so Izzy was a good sleeper, and then Juniper, my youngest, was a bad sleeper, like a fussy sleeper. She would sleep like sometimes 30 minutes and then be back awake. And even though everything I knew, like I'd already trained to do, like everything that I knew about feeding and about normal infant behavior, it still threw me because
Yeah.
that wasn't my experience the first time. And I was like, is there something wrong? Surely not. I've breastfed successfully before. Why is this happening? And it was just, yeah, having those little cues is super helpful. Like, no, she is fine. She's gaining weight and her nappies are normal. Like, it's just, this is a normal baby. And I was duped the first time.
Yeah, absolutely. It can be really helpful to just know, to reassure yourself, because yeah, even as a breastfeeding counsellor, second time around, I was like, yep, I know what's all good. And I still had those random moments of doubt going, hang on, is he getting enough milk? And yeah, it's vital to just be able to kind of like go, well, he's had this many nappies today. So yes, he is getting enough milk. That's all good. It's
Yeah.
fine. No worries.
Yeah, definitely. And I think it's hard as well because often people will say to you, like people who do formula feed or people who are just not used to being around breastfeeding people will ask those questions, but they'll say, well, how do you know how much they're getting? And stuff like that. And you're like, I don't. And even though you know that that's completely normal, it can still plant that tiny little seed of
Yeah.
doubt. Like, but I don't actually know. And you're like,
Yeah.
that's fine.
I think sometimes it's such a big thing to just trust in your body and trust in your
Hmm.
baby. And it can be really difficult to do this. It's exactly the same with birth. You know, we talk
Yeah.
about trusting in your body that it can do this and it knows what it's doing. And I just think as a society, we just don't trust ourselves and trust our bodies that they can do this. And it can be done. But actually, if you just put faith in it, yeah, you don't need to know exactly the amount of mils that a baby is having. You don't need to have that to know that they're feeding well. You just need to go with your baby, go with your body, trust that it's doing all the right things. And if in doubt, the nappies are going to tell you, because what comes in is going to come out the other end. And
Yeah.
that is the best indicator of knowing that actually you are giving your baby enough milk. And obviously, if they are having less than normal, it doesn't necessarily mean jump straight to giving formula or bottles. Just get some support,
Yeah.
because it might just be something with latch. It might be simple as offering both breasts instead of one, or doing some breast compressions, like really, really little things that just help a bit in terms of them getting a little bit more milk. It doesn't always mean that something is terribly, terribly wrong. Just, yeah, get some support basically.
Yeah, definitely.
And yeah, on day 5 as well, you get a weight check with the midwife, and that's when there will be, well, most likely, a bit of a weight loss. And if you're not prepared for that, sometimes when the midwife will go, okay, so they've lost this much of their birth weight, you go, what?
Yeah.
But I've been feeding constantly. How on earth have they lost weight? And that's just really, really normal. For all babies, regardless again of feeding method, they're probably going to lose up to about 10% of their birth weight without it being a worry at all. And that's just because of the extra fluids that they've had. And that's totally, totally normal. Don't be concerned. Up to 10% is normal. And they should be reaching their birth weight again by about 2 to 3 weeks. And again, really, really normal. Don't panic about that.
Yeah.
But yeah.
No, that's super helpful. And we've kind of touched on it, but so what would you say are like your top couple of tips for those early days? I mean, you've given so many top tips already, but what would you say is like the top thing to just be mindful of in those first few days?
I think the biggest one is literally, yeah, set expectations really low, that you're just going to probably be feeding very frequently. You're not going to be up and about. You don't need to have lots of people around your house. Honestly, for that first week, I would say no visitors unless they are coming to do something for
Yeah.
you. No visitors that are going to be coming and asking to hold the baby and asking for cups of tea. If people come round, they are to do washing up, they are to bring you some food, they're to do something helpful, because your main job is to just sit there and bond with your baby and feed your baby and build your milk supply. And I can say from experience that it works. So, first time for me, I kind of like fought against this normal newborn behavior and trying to feed often. And we did lots of stuff. We were up and about quite quickly. By 6 days old, I think we had like a garden party and stuff. It was full on. And then she lost, at day 5, she lost about 9.8% of her birth weight. So within the normal range, but it was quite decent. So they wanted us to just come and reweigh again a few days later. And it took a while for things to become established and for us to kind of like feel confident with feeding. Whereas second time, I basically just resided to my bed in my pajamas for 2 weeks while my husband was on paternity leave. It was Christmas holidays, so I just sat in bed all day and it was absolutely fantastic. I let him be off and on the breast whenever he wanted. We co-slept, so we were just like sleeping in between it. And he lost only 2% of his birth weight. And we felt confident and established with feeding a hell of a lot earlier than I did the first time. So it really does work, and it helps you to get into that rhythm a lot faster. If you can just kind of surrender to it and just let it happen, it honestly, you kind of reap the benefits of it a lot earlier compared to if you kind of fight against it. You in that fighting against it for a long period of time until it does finally settle, compared to if you just kind of go, right, this is just going to be it for a little while. I'm just going to sit in bed, let them feed as long and as many times as they want, and it'll be fine. And you'll be recovering after birth as well. Again, regardless of the kind of birth you've had, you still need to rest and recover. Even if I had a home birth last time and no tears at all, I still needed to recover. My body had still been through a lot and I still needed to rest and recover. And it was perfect. It was just what my body needed and just what he needed as
Yeah.
well. So it really does help. And if you can focus on anything, just literally focus on the feeding, and everyone else can do all the other stuff that needs doing. If anyone wants to help and you get messages of people saying, oh, can I come round? Yes, absolutely. As long as you bring some food, as long as you do the hoovering, something like that. And
Yeah.
just let go of the routine.
Yeah.
Don't worry about routine. They're not going to get into a routine for
Yeah.
quite a while,
There's
even
no such thing.
sometimes it takes a long time. So just forget about routine. Ignore the clock.
Yeah.
Don't look at the clock in terms of, oh, well, they've only fed, 2 hours ago. Ignore it. Just respond to your baby, because they don't know the clock. They
Yeah.
don't know when they're meant to be hungry. They just know that they are hungry right then. And get loads of skin to skin.
Yeah. Yeah.
Because it is honestly, skin to skin should be used as a discharge sort of prescription if you're leaving the hospital with your baby. They go, well, this is your medication, this is the pain relief that you should take, and do skin to skin.
Yeah.
Should be that, because it is magic. There are so many benefits to it, even without the breastfeeding side of things, but it helps with your milk supply. It helps baby to root for the breast, so it brings them onto the breast more frequently, so it helps to establish things. It helps with the latching as well. It's absolutely fantastic. You notice those feeding cues a lot sooner. And for
It's
me,
going to make you feel better as well, because like having skin to skin, because it's boosting that oxytocin, is actually being like linked to a reduction in postnatal depression,
yeah,
early stage.
absolutely.
So it's mad. Yeah, I agree. It's absolute magic, skin to skin. I wish that was something like you say. Yeah, when the midwives would send you home or leave or whatever, I wish that they just said to you, yeah, this is your prescription. Actually, the most
Yeah,
important thing you can do is lay in bed skin to skin with your
yeah.
baby.
It's almost like a bit of a reset button as well, I think, for breastfeeding. So for me, if anyone is having struggles with breastfeeding, like the baby's not latching or they're struggling in some sort of way, I just say, just get in skin to skin.
Yeah.
And by skin to skin, I don't mean just there for like 10 minutes. I mean a full day.
Yeah.
There in skin to skin for a whole day. Don't come out of it. You
Yeah.
need to stay in that position. And it really does help. Like if a baby isn't wanting to latch, I just say, just sit in skin to skin.
Yeah.
Because then if it comes to it and the baby doesn't latch, you've still gotten so many benefits just from the skin to skin. You've not lost anything from doing it, because it's regulating the baby's temperature and heart rate, and it's giving them oxytocin boost and yourself. It's really, really beneficial. It's helping with the gut microbiome as well. It is just magic. So even if your baby is struggling, you don't end up sort of having that latch. It doesn't matter, because you've
Yeah,
had
you've not
it.
lost anything. There's no risk factors to doing it. All you can do is gain from it. Even if you don't get your intended outcome, you still
Yeah.
get the wealth of other benefits. So yeah, I
And I think
completely
my biggest tip is to always have water, snack, TV remote, and phone charger with you
yeah,
before you sit down to feed, because you might be there for a little while. So
yeah,
never sit down without all of that stuff.
yeah. Put it in a little bag, a little box.
Yes.
I used to have a little box, like, well, not a box, it was like a tub with
Yeah.
little handles on it, and I could just take it wherever
Carry
I
it.
wanted.
That's what you need.
Yeah. And yeah, I say that to everyone, all of my clients. I'm like, have you got a little box anywhere? And they're like, why? I'm like, just bring it and I'll show you. Like, you're gonna use this. You're gonna
Yeah.
need it.
And get into a good box set, because you're going to be sitting there feeding for quite a while. Pick a series or something that you can really get into. Mine was Grey's Anatomy this time, and there was so many episodes, so I really got into it, and it meant that when I did go to sit down to feed, I was excited about it. So
Yeah.
this is my time to sit and watch Grey's Anatomy. I'm gonna have a great time. Not, oh my gosh, feeding time again.
Yeah.
So it made me excited for it.
Yeah, I think that's a really good tip. And I think something like is, so if you've got like older children, like toddlers or anything, the second time round, it's like you don't have control of the TV at that point. So I just read books, but like
Yeah,
on my phone or on a Kindle, like have
yeah,
those next to you, or put your headphones in, just put one headphone in it and listen to a podcast. Because
yeah,
yeah, and then because you don't, it's hard because you don't want to just stick your kid in front of the TV all day. But in those early days, you
yeah,
don't have a choice always, you know, like put them some Lego on the floor, but also you're going to stick CBeebies on. And then, yeah, stick yourself a headphone in with some podcasts or have a book on your Kindle. And then, you know, you're meeting both your baby's needs, but you're also not going brain dead, basically.
yeah. It's yeah, do something for you in that time, whether that is TV, podcast, book, listening to music, whatever it is. Do something that actually you're going to enjoy in that time so that it does make it a little bit more enjoyable for you. Because otherwise, you sit there, like you said, in silence, just kind of
Yeah.
staring at a blank wall. It can be really boring because they might feed for 5 minutes, but they might feed for up to 45 minutes.
Yeah.
So you don't know how long you're going to be there for. So
Yeah.
do something that's it's going to make it a little bit nicer to sit there rather than staring at a wall.
Yeah, 100%. No, I think those are great tips. And then as well, like kind of like the next sort of thing we wanted to talk about is the advice that might be given in hospitals or by family. And we did kind of touch on this again at the beginning, but it's more, is it helpful or is it harmful? I'm sure you've got a really good experience of this from your role, of the advice that people are given, especially what I find quite worrying is the advice a lot of people are given in hospitals or by
Yeah,
maternity staff. And it is so well meaning. They're not giving bad advice on purpose, but a lot of the training is very outdated. And I've had clients who have gone, well, the midwife said that they should feed every 3 hours, like on a schedule, and I should wake them up if they're not awake, and I should not feed them if it's not been 3 hours. And I think that's probably the main one, but I know there's quite a lot. There's like don't feed to sleep and things like that. And how sort of harmful is this, and what how would you sort of combat
yeah.
this?
It's so difficult because especially if it is coming from a professional, it's just that much harder to deal with. The thing that I find most common for one is the people that have maybe experienced gestational diabetes while
Yeah,
they are pregnant, and they are basically told during pregnancy that they're going to probably have to give formula
yeah,
because the baby's blood sugars are a little bit low, but they don't get told about maybe hand expressing or harvesting colostrum to help with those blood sugars. None of that is is discussed, and they just kind of are told, I'm speaking to them on day sort of 2, 3, and they're like, oh yeah, my midwife has told me we need to give formula to help with the blood sugars. I'm like, formula isn't necessary. It's not something that has to be done because of that reason. It is not common for formula to be needed in those early days. I mean, one thing that really angered me once while I was working in the hospital actually was we'd looked at someone's notes and it said they wanted to breastfeed, and then 20 minutes after a vaginal birth, the baby hadn't fed. So they offered formula in a cup. And I was like, 20 minutes? This baby has literally just been born. The placenta's probably not even bloody out
yeah.
yet. And they're
That's
already
insane.
pushing the formula. It doesn't make sense. A lot of the time, I think in hospitals, formula and bottles does tend to be pushed a little bit more, but just because it's easier
Yeah,
for the staff, because they don't have the time. And I really do sympathize with that. They just don't have the time to give that support. So it is much easier to say, well, let's just give a bottle of formula for now and we'll see how things are later. But that's not just a for now. It tends to have a knock-on effect. It's not just something that happens just for this one feed. It does have a knock-on effect and it does continue. It's
yeah.
they don't realize the damage that it can cause in terms
Yeah,
of
it's really hard. I've had similar, and I've had a few clients with gestational diabetes this year, and I've had like, so I had, yeah, they got told the formula thing, and then I had a client who was like, well, I'm just gonna colostrum harvest, and then I've got it, and the midwife was like, well, yeah, I guess you can do that if you want, but we would still recommend having formula around. And she was like, why? Like that makes
that.
no sense. If I've got colostrum harvested, it doesn't make sense. And yeah, it's hard because in hospital it's very pushy with formula, and you'll even
Yeah,
hear people saying like, oh, pack some in your bag, even if you're planning to breastfeed, pack it in your
constantly.
hospital bag. And it's like, that is so not needed because
Already putting that doubt into your mind
yeah,
as well that actually it's not going to work out.
yeah,
That's
and
not
I
helpful for your
yeah,
own
I think
mindset.
it's not helpful at all, and it's just so not needed, because the worst case scenario, if you
They do
really
have it.
couldn't, they would have it,
Yeah.
or like you can go to a 24-hour shop and get some, like your
They're
baby's
not
not
going to
going to
let a baby starve, and they're not going to starve in like 5 minutes while you do get formula. It's not going to happen. So it's
starve.
really, really frustrating. And I think what I get really frustrated with is when they do work out sort of possible top-ups, they are working out the top-ups in such a large amount,
Yeah.
absolutely huge scales. They go, I'm speaking to someone on day 5, they go, oh yeah, they've told me to top up 60 mil after every feed, every 3 hours. And I'm just like, 60 milliliters for a 5-day-old baby is more than a full feed.
Yeah.
On day 5, they probably should be having about maybe 40, 45 mils because their stomach is still so tiny. But they're being told to top up this 60 milliliters, which means the baby is not going to want to come onto the breast or not feed effectively at the breast because they are so full up from the formula. And
Yeah.
it means that they are not then getting the milk supply up because they're literally giving a humongous feed. And that really makes me quite cross as well. And also, people aren't given the advice and suggestions of knowing how much to actually give because sometimes that full amount isn't needed. So I talked to people about looking at whether it was an effective feed or not and determining how much of the top up to give. Maybe if it wasn't a very good feed and they literally just sat on and did nothing, yeah, we give a full top up. But maybe if they come and do some sucking and some swallowing, we don't give the full top up. It just feels like these amounts are huge. And again, the amounts of, those little pre-made formula bottles that you're
Yeah.
meant for newborns to bring into the hospital, they are 70 milliliters.
They're huge.
A baby's tummy at birth can handle 5 to 7 milliliters.
Yeah.
Why are these formula bottles so huge? So then obviously women and birthing people, when they're breastfeeding, they go, oh my gosh, I'm literally trying to squeeze my breast. I'm just seeing drops of colostrum come out. This is what they're meant to be having, the 70 mils. I definitely haven't got enough milk. And
Yeah.
then they really doubt themselves. Those formula bottles are humongous. That is the amount that probably a 6-week-old baby
Yeah.
would be having, not a newborn.
Yeah, it's
They're
it's
really massive.
really it's really tricky, and it's like what we see in birth education as well, is that people are being presented with these options and not talked through the risks and the benefits of it. They're just being told, well, if you give your baby formula, it's going to be helpful, it's going to stop your baby from starving. And
Yeah,
people go, well, I don't want my baby to starve, I better give it. And they're not going, but actually the knock-on effects of that is X, Y,
yeah,
and Z, and it could be detrimental for your breastfeeding journey. And there are all of these other options. And would you like to try these other options first, or would you like to just try a smaller amount, or blah 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 blah? They're just going, your baby might starve if you don't do this. I'm not saying everyone does this, because it's absolutely not. There are some amazingly highly trained professionals in the maternity services, but it is something that I think is becoming more common, and I'm hearing from my clients is, if they have any problems with breastfeeding, they ask for support, and they very much just get that regimented, just give formula,
yeah,
or just feed
absolutely.
every 3 hours, anything else is wrong. And
Yeah,
it's so tricky because you can't, people, but they're the professionals, surely
yeah,
they know.
yeah. The one thing is, that, again, that professionals say that is really outdated advice that they are still saying often is feed on one breast for as long as possible to get all that hind milk. If the baby comes off the breast, put them on the same breast again to get the hind milk. That's outdated. We know it's outdated. Hind milk and fore milk is not a thing. It's not something that suddenly the breast milk changes from it being really watery to really, really fatty. It is a gradual change because of the baby's sucking pattern. That's the important thing. It is noticing the baby's sucking pattern, and that's determining what kind of milk that they are getting. All milk is good milk. And actually, if a baby is like maybe struggling with weight or you are struggling with milk supply, what you should be doing is offering both breasts
Yeah.
because you want to get that let down so that milk that starts flowing really nice and quickly, and then offer the other breast to get that milk let down again. And then that'll be increasing supply, that increases the milk intake that a baby is getting. And so many people are just told, yeah, you need to put them on the same breast again. And this is detrimental
Yeah.
to weight gain, to milk supply. It's not helpful, and it is very, very common told to people. So if you can, just offer both breasts. Try and offer both. If they don't take the second one, obviously that's a different story. You don't need to try and force a baby onto the second breast if they don't want it, but offer it to them because if they 9 times out of 10, they probably are going to take it, to be quite honest.
Yeah, if they want a bit more milk, they're going to take it. If they're
Yeah,
super, super full, they'll push it away.
yeah,
And there's your answer to whether it's needed or not. You
yeah.
don't need to overthink it more than that. I think, yeah. If we were all just more in tune with our bodies and
Mhm.
didn't just, from the minute we get pregnant, we outsource our like innate knowing, we just completely ignore that, and we're like,
Yeah.
oh no, I'm pregnant, I must need to put all of my trust into other people and into computers and into machines to now tell me what to do. And actually, if we just listen to our bodies a little bit more, then, you know, everything would be just a little bit easier, a little bit less stressful, a little bit more
Really
straightforward.
are. So true. It's just trusting your body and trusting your baby, knowing that actually you two are perfectly fine together. And it's the same with birth, like you said, just trusting in yourself. We don't need to put our faith into computers, into the system, into various things to tell us what to do. We didn't have this many, many years ago. We did just have communities and we trusted in it. And we just, yeah, we need to sort of go within during pregnancy and really just listen to ourselves, try and ignore all of the noise on the outside and just go, actually, what is my body and what is my mind telling me, regardless of what's going on around. Ignore all the sort of societal pressure and all the information I've heard from various different places. What is it telling me? What is my mind telling me? That's what you need to listen to, and it
And I
does
think
help.
when people do that as well, it's easier to find the root of the problem if there is a problem,
Mhm.
because we've not gone looking for it. We've listened to our bodies, and where we understand how breastfeeding works, and we start to feed our baby, and we realize that actually maybe there is something that's wrong, and then we can seek support for it rather than just immediately putting all of our faith in someone else. If you actually listen to your body and there is a problem, it will shout at you loud and clear that there is a problem. It's not like you're going to miss it by doing
Yeah,
this. You're going to be
100%.
even more in tune with it if something does arise, and it'll be
Yeah,
easier to spot. So it's like kind of like a win-win situation. It's like you're so in tune with yourself. People think that when you talk about that, you're saying that you should never seek medical help, or you should never seek assistance, or you should never seek support. And it's like, actually, what that's making you do is find that more accessible, because
yeah,
you're so in tune that you can really quickly pick up something's
yeah.
not right.
Yeah, it's doing the complete opposite. It's not, refusing medical care and stuff like that. It's something that I talk about in my hypnobirthing classes as well, in that, listen to your intuition. If it's saying, no to the induction, okay, listen to that. But also, if it's saying yes to something, is it telling you that actually there's something wrong? There's so many people that kind of like they go in for reduced movements or something and they're told, no, 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 everything's absolutely fine. And they're just like, no, I've just got this gut instinct.
Yeah.
Something is wrong. Listen to it.
Yeah.
Really do. Don't just completely ignore it. It's there for a reason. So
Yeah.
yeah, completely agree with you.
Yeah, 100%. And yeah, that's something, like I said, like you cultivate that throughout pregnancy, and it's going to make your entire parenting journey like essentially like easier, but for the entire like postpartum
Yeah.
period, for everything. It's not just for the newborn days. It's
No,
like,
it's
you
for
can do this
life.
now, you can do this until your kid has left home, basically.
Oh God, yeah. It's not just something that's for right now. It is forever, literally.
And so like leading on from that, I just wanted to quickly talk about, because like I said before we started recording, I'm not asking you to give away your entire skill set on this podcast, but just as like a brief overview, what are you looking for in those first few days in a baby that is happy and that is feeding well?
Yeah, I think the key thing is nappy output. Like I
Yeah.
said, if the milk is going in, it's going to be coming out. So wet and dirty nappies, and this will vary on a day-to-day basis in that first week, because basically for every day that the baby has been alive, or however many days the baby, how old the baby is in terms of their days,
Yeah.
that's how many wet nappies they'll be getting. So if a baby is 3 days old, we're looking for a minimum of 3 wet nappies. More than that is great, obviously, more is brilliant, but we're looking for a minimum of that many. And then the dirty nappies as well. And dirty nappies are really important because they can be a really good indicator of like a bit of a red flag. And people say all the time, like, oh, a breastfed baby can go 10 days without a poo. Yeah, they can later on,
Yeah.
after about 6 weeks. In that early first few weeks, at least 1 to 2 per day is really important. And if they aren't getting that, if they do go a few days, I'm not saying that everything's going to be terribly and something going really, really wrong, but it's a good idea to seek some support and just investigate it a little bit more, because it may be that maybe they aren't getting enough. Maybe we just need to do a change of latch a little bit, or offer the second breast a little bit more frequently, or maybe the baby isn't waking very much at night, so we just wake them up in the night for a quick feed in the middle of the night to just get that extra boost in. So it is a good idea to check it out. And then that colour transition, like I was saying earlier, going from that thick meconium, sort of black, tarry, like Marmite sort of texture poo that is horrible to clean,
Yeah.
colour, and then like a mustard yellow. And a lot of people do worry when it gets to that mustard yellow colour, it's really loose, especially in comparison to like that meconium poo. And people go, oh my goodness, have they got diarrhea or something? Because it is so watery, but it's not, it's totally normal for it to be like really, really loose, very yellow, kind of like a consistency of like a korma.
Yeah.
I hope that's not going to put people off eating a curry. And it tends to have almost like, it looks like seedy bits,
Yeah.
but it's not seeds. It's like, it's basically bits of fat that hasn't been fully digested. But those are the best indicators. And honestly, I recommend to anyone, if you are going to breastfeed, just keep like a little bit of a note for the first like week or two, maybe while you're getting to grips with things and maybe building up your confidence. Just do like a little tally chart or write down when they had a wet nappy, when they had a dirty nappy, what was the dirty nappy look like? Because then if you get to like 8, 9 p.m. and the baby's cluster feeding and you start to have that moment of doubt and you go, maybe they aren't getting enough milk, maybe I'm doing something wrong, and you can look back over that and go, well, it's day 4, they've had 5 wet nappies and 3 dirty nappies and the colour is already like a yellow colour. That's a really good sign that actually they are getting enough, so I don't need to worry. So it's your sort of reassurance to yourself that they're getting plenty of milk, and that is honestly the best way to go about it for yourself. There's lots of other ways, you know, weight gain. You can look at if they are generally settled after having a feed. That's a good sign. Obviously, there is going to be some times where they're a bit unsettled. That's normal, but if they're generally settled, um, and we want to have at least 8 to 12 feeds in 24 hours. So if they are having less than that, it might actually be not a good thing because it might mean that they are extra sleepy and they're struggling to wake up. And I say 8 to 12 feeds, but the majority of babies will feed so much more than that.
Yeah.
Like, if you did it myself when my little boy was 3 months old, I thought, do you know what? I'm really curious how many times he actually does feed in 24 hours because I can guarantee it is not 8 to 12 feeds. And now I did include little like comfort feeds where he came on really quickly, ones that he came on during his sleep and stuff. But I think it came up with like 26,
Yeah.
24 hours, and that's absolutely fine. And I think it's making it very clear that that is a minimum
Yeah.
of the foods they should be having, not a maximum. If they are feeding 20 times in a day, that's totally fine. That
Yeah.
is absolutely fine. You're not doing anything wrong with that. It's quite normal for them to feed very frequently. But yeah, keeping an eye on nappies is the best way that you can just sort of reassure yourself that feeding is going well. There is that bigger picture, obviously, but if you just need that reassurance, especially sort of before you get those weight checks of what's going on, especially like, you know, that first up to day 5 before they do that initial weigh in, you can really be like, oh, well, are they? I don't know, because we've not had anything checked really. So it's that reassurance to yourself is incredibly helpful and incredibly invaluable. If you've got that, you know, that's half of the problem. Because if you do have those moments of doubt that, well, they're not being put down, it must mean I'm not getting, you know, giving them enough milk. You can just go, actually, yes, they are getting enough milk because they're doing all these wet and dirty nappies.
Yeah. And they don't want to be put down because they've been in a womb for 9 months that was warm and they were constantly held and they were constantly rocked and they've never been
Yeah,
away from me. That's why they don't want to be put down.
yeah, yeah. In the hypnobirthing course, we do like a bit at the end of like womb to world, the
Yeah.
transition, and we sort of like write down all the stuff that they're experiencing in the womb and then all the stuff that they're experiencing in the world. And it's almost like a light bulb moment for people because they go, hang on, it's the total opposite
Yeah.
what they've been used to for the last 9 months or however long you've been pregnant for. It's
Yes.
like, it's no wonder that actually they're not happy with being outside in the world and not wanting to be put down because
Yeah.
it's a completely different environment for them. It must be really, really scary.
Yeah, definitely. And so what do you think about in terms of the mum or the person who's breastfeeding? So like what can they look for that is normal or isn't normal? So oftentimes you hear people say that it's painful at the beginning and sort of how normal is that?
I'm probably going to upset a lot of people saying this, but feeding should not be painful.
Yeah.
And by that, I mean that it should not be excruciatingly painful throughout a whole feed. You should not be getting cracked nipples, bleeding nipples. That's not normal. But 90% of people experience painful feeding, and about 35% of people stop because of painful feeding. So it's really common, but that doesn't mean it's normal. But people constantly say, like, I'll be prepared for the first 2 weeks. It's going to be really, really painful. Lather on the cream and just grin and bear it. Don't grin and bear it. Please don't grin and bear it. Get support. It might be a little bit of a discomfort for the first maybe 60 seconds or so, but that should subside and you should then feel comfortable for the remainder of the feed. If it is not comfortable for the rest of the feed and it just stays painful, there's something that's maybe not going right with that latch, because it shouldn't be that painful. And you should absolutely get some support with it, because yeah, it shouldn't be painful at all in terms of that. And I hate that people have to experience that and go through it and they just think that that's what they need to push through for it to just work. And cream is something that I have a bit of a hatred for, because people just use the cream as like, well, we'll just keep putting on the cream and it'll get rid of it. It's not gonna do that unless you get the latch changed. And actually I find that sometimes the cream can make it worse, because people lather on that cream all over the breast. What's cream? It's very slippy. It's incredibly slippy. So a baby is then going to come onto the breast, slip, go right to the end of the nipple, and then it's just going to be more and more painful. So it's this cycle of us putting on the cream to help, but actually it's making it worse.
Making it worse. I'd never considered that before until maybe it was recently, a couple of weeks ago. I saw a post on Instagram, someone shared about it, and I was like, oh my God, that makes so much sense, because I'd never really, it's not, breastfeeding never was really painful for me, so I didn't really use the creams. But I have in the past, said to clients, yeah, these creams you can get and like they're meant to really help and stuff like that. And then I saw that post and it was like a light bulb moment of
Yeah,
like, of course that's not, I know it can be helpful a little bit, but like you said, lathering it on is
yeah.
not, it's a slippery slope, isn't it? Literally.
Literally
Not
a slippery
helpful.
slope. Yeah, I
Yeah,
tend to say that if someone is using it, use it for only if you have got like an open wound, because that's then moist wound healing, which really does help. But literally just putting a little bit onto the area that's affected, not lathering it on. And actually, it's just as easy to use some of your breast milk, because that has healing properties in it, actually. So it's going to be helping loads and it's still using moist wound healing. So
yeah,
if you don't want to, you don't have to buy that really expensive purple
yeah.
tube that is
It's
so
expensive.
pricey.
It's
Don't do it.
honestly,
Just
yeah.
squeeze your boob.
Yeah,
You've got your own special nipple cream that has healing properties in it. Much
yeah.
better.
It
And actually,
doesn't
a lot
cost
of
you
people,
15 quid.
yeah, and a lot of people are actually allergic to the lanolin that's
Yeah,
in those creams. So some people, they might be lathering this cream on, hoping that it'll help, and actually they're then getting an allergic reaction and causing it to be more painful.
yeah,
So yeah, use your own breast milk and you don't have that problem of an allergic reaction either.
yeah.
Very helpful.
No, that's super, super helpful. No, thank you for sharing. And then the last thing that I wanted to just talk about before I let you go, because we've been nattering on. I mean, to be fair, for how much we both talk, we've kept this
Yeah,
quite civilized, but
yeah. I
it's still been
expected it to be
quite.
longer, to be honest.
But yeah, we've kept it quite succinct. But
Yeah.
what would you say would be like, where would you go if any problems arise? So whether that is pain or whether it's problems with latch, or what would be sort of your levels of support? Where would you go?
Yeah, so most areas will have a local peer support group, which can be really, really helpful to go to like just get that peer support, chatting to other mums. You don't just have to go if you've got problems. People just come for
Yeah,
like that society, having a bit of a social time, and just speaking to other people that are probably going to be going through the same sort of stuff as you is
yeah,
really helpful. And it's that kind of like first step. If you maybe have got painful feeding, coming to that's a good option, because it may just be a very small adjustment with the latch to actually get things a bit more comfortable, so you don't need to do anything else. Sometimes you can get then referred into the trust like infant feeding team, if like maybe people are thinking about, oh, maybe there's a tongue tie or something. What I would say about tongue tie is that a lot of professionals are not trained and qualified to check for tongue ties. So please make sure if someone is checking that they are someone that's qualified, and looking in the mouth is not checking for tongue tie. have fingers in the mouth. That's not checking. So yeah, they might be able to sort of refer onto the infant feeding team within the NHS. And then from that, there's sometimes breastfeeding counsellors. So like myself, we can do sort of home visits and stuff like that. We can speak to you on the phone, various different things like that. There's the National Breastfeeding Helpline as well, if you just want to maybe have a quick chat. Obviously, it's never guaranteed that someone is going to answer because, again, it's all voluntary. And then if you sort of want someone that is really almost like gold standard, you've got an IBCLC. And they are very, very knowledgeable in that sort of thing. So that's more for sort of like really, really severe sort of problems, I want to say, more than the standard stuff. Obviously, I'm sort of in the middle. I'm higher than a peer supporter, but not quite an IBCLC level. So breastfeeding counsellor level is kind of like that in between. But I mean, I'm not blowing my own trumpet, but I do have a good amount of knowledge. And the people that I speak to, they're kind of like constantly like, wow, your brain is just overloading, full of information. And they're just like, God, I didn't even think of that. I do feel like my brain is just full of stuff that is birth and breastfeeding and like statistics in terms of that sort of thing as well. Like I can just pull sort of statistics of how many people stopped breastfeeding before they wanted to. Oh, it's 83%.
Yeah, it's mad, isn't it? Like I completely agree. My brain's exactly the same. And I think like to become an IBCLC is just too much of a commitment for a lot of people. The amount you have to do to it, it's not that it's inaccessible to a lot of people, but like if you are working and running a small business and have small children, maybe it is something that a lot of breastfeeding counsellors want to do. But the amount of work that goes into becoming one is
like for me, you have to have done either a health science or like be a nurse or something like that before. And I don't have like A levels in that kind of area. So for me, that I've got to then do that first. So it is a very long journey, but I do feel like I've got a lot of knowledge to be able to pass along, that it's just the road to becoming an IBCLC is just a little bit too long and not accessible for me for this current time. But I do offer lots of other things. I do preparing to breastfeed sessions, which people are finding very helpful. I do sort of phone support, and that is phone support for at any point in time of your breastfeeding journey. And I do really strongly support people stopping breastfeeding as well. I'm not just there for continue. I'm not going to keep pushing people to keep going. I feel like it's really important to get that good support with actually stopping breastfeeding as well. It's not just a right, well, you just stop. That's how it goes.
No.
And then I do offer home visits as well, in terms of like that support as well. I talk a lot on my hypnobirthing courses as well about breastfeeding, because I felt that is something that, again, it doesn't just finish at the birth. That's not just it. We need to do that postnatal preparation as well, and doing that preparing to feed too.
100%. Yeah, no, I agree with everything you've said, and I'm really, really grateful to you for coming onto the podcast and for sharing a tinsy little bit of what your brain is packed full of.
I could talk about this for hours, so you're lucky we've kept it at like what, almost an hour and a half.
Almost an hour. Like, but you've shared so much, but I just know that it is just such a small amount, even though it's so much.
I was like really trying to keep it compact.
It's like, or it would be like a series.
There'd be a full series about it.
So to round out, where can people find you? So social media, website, anything like that. What have you got, and what have you got coming up for feeding and for pregnant people?
So you can find me Facebook, Instagram, and I'm on TikTok sometimes. Not as much as you are.
Oh, don't even get me started on TikTok.
I know, I saw people are being a little bit.
People are insane. People are unhinged on TikTok.
Not nice people. But yeah, I'm on all of those at BeasBirthandBoobs, and my website is beasbirthandboobs.co.uk. You can thank my husband for the business name. He came up with it. I'm very grateful for him.
It's so good.
I was quite pleased with it when he came up with it. But yeah, I've got hypnobirthing courses around the area, so Leicestershire area, for January on Saturday mornings, and in March in, I think, Sunday mornings. And then I do private stuff in between then. So if you wanted a one-to-one course, or if you wanted to do that preparing to breastfeed sessions, I offer those over Zoom as well. So I've done quite a few preparing to breastfeed sessions online. So I'm more than happy to do those for anybody around. Obviously, if you're in the area, I can, do it as a home visit or something instead. But yeah, pretty much if you are unsure, or you think, oh, I've got a couple of questions, you can always just come and message me. I'm more than happy to chat with, and absolutely no pressure to book anything if you kind of just want a little bit more information as well.
Perfect. So I will leave the links to all of those in the show notes, so people definitely go and check that out. And thank you again for coming on and sharing your knowledge with us all.
Thank you so much for having me on. It's been lovely.